The treatment that we're actually doing today on Babs is a treatment called Sculptra. It's a deep tissue filler. What it is, it's what we call a poly-lactic acid, and this stimulates your own collagen growth. It helps improve the skin's texture as well. Over a period of time, she'll get more of a glow on the skin, where the skin looks not necessarily tighter, but a lot healthier. So even though we're injecting Babs today, that's not the result that she'll get. She'll come back in probably 3 months, let us have a look and take the pictures, and then at 6 months, because over that period of time it's getting better. The areas that we're actually looking at is where she's lost some volume on the cheeks. This is not a superficial filler, but on the fine lines on the areas around this area here, they will look as though they've improved as well, but we're targeting more the hollow areas on her cheeks. What we want to do is mark out the areas where we want to treat. As you can see, the left side on this area here is slightly deeper than the right side. So I want to concentrate a little bit more on this area here. So what I'm going to do is mark out where I want to inject. We don't need the area symmetrical because obviously the volume that's been lost is not the same on both sides. So I'm going to start from the cheek area here and work my way. This is the middle bit here where I want to concentrate, and what we have to be is very careful on the eye area because you've got a lot of nerves around here that we don't want to touch. What I want you to do is just turn your head that way, and if you can close your eyes for me, okay? And the first one you will feel, okay, and we'll let that settle in. So what will happen now, it'll feel more numb around this area because the product's actually mixed with the lignocaine. It'll be more comfortable for Babs to have. And you can see it's actually what we call a deep tissue filler. Although it's a lot of injections in this area, certain areas will bleed probably a bit more than others, but it does settle pretty quick. The injection marks will settle within a couple of days. So I'm going to concentrate on this side a little bit more than the other because this, to me, needed more volume in this area. Obviously, the way that I'm massaging this area is quite deep tissue massage, yeah? So the areas that I've covered, what I want you to do is do similar movements, okay? Where it's not just a case of just smoothing these areas out. What I'm actually doing is making sure I'm happy with it, but I want you to stimulate the growth where I've put it by massaging for a few minutes twice a day. So obviously you could see the Sculptra is a completely different treatment to the dermal fillers. You're not getting an immediate result with it, although it did look a little bit more volumized in the areas that we're injecting. But over the period of the next few months, what will happen is Babs' skin will look a lot better, and the areas will be more volumized in that area. So we'll keep an eye on it over the next 6 months. It is a good treatment, it's just that a lot of people are put off because you've not got an immediate result. But for people that want something where people are not going to notice, I love this product. It's a really nice product for where you've lost the volume in the cheeks.